Now, it's well known that the Union's approach to tackling the global lung health challenges is innovative yet practical and focused on the provision of quality care. TB Data for Action, developed by the Zimbabwe TB Control Programme and the Union, is an inexpensive and practical approach that starts bottom up at the health facility level. Health staff, including district-level teams, are trained and supported through data-driven supervision. And TB Data for Action teaches the analysis and use of the data that they're already collecting routinely to report to their national programme, and focus also on the leakage gaps in the care cascade for TB treatment and prevention services. TB Data for Action is built around local and active use of routinely available TB data for decision-making and management through its use. Data quality is also supervised, assessed and improved. And to find out more about this, I'm joined now by Professor Jane Carter, who is actually the former president of the Union. I know there's been several former presidents, but it's so lovely to have you here, Jane. I know you were saying how delighted you've been back to be here in person and really enjoyed the opening ceremony. But first of all, let's think about TB Data for Action. How did you first become aware of that?
So at the end of my presidency, I had the opportunity to join the Principals course, which is the premier course of the Union, now done in Zimbabwe. And so there's 2 field days, and they've been using TB Data for Action since it was developed there for years. So I was just astonished when I saw it in the field.
And what impressed you most about the method?
It's so simple and elegant. In the past, we always just used raw data, and this takes the raw data collected by the facilities, changes it using their encatchment populations into an incidence. Now that might seem complicated, so let me just take you through 2 examples. So if Facility A was reporting 100 cases and Facility B is reporting 75 cases, with the raw data you think A is doing better than B. But if you begin to change that into their encatchment populations, it tells you how much of the incidence cases in the patients that they serve they're finding. And you may find that A is finding a much lower number of the prevalent cases than B. And so it totally flips your conception around about who's doing well. Or for a second example, you can begin to find your local cascade of care. So again, say in Facility A, they send 10 patients for sputum, 7 are positive for TB, but only 3 are started on care. They don't need to go out and search for more cases, they just need to call the patients that are already being diagnosed to bring them into care. Whereas in B, they actually may only be asking for 3 sputums a month, but yet seeing 250 patients with respiratory diseases. They're registering all of their 3 patients that they find, so their problem is to do more screening. In the past, people were just told, find more cases, but if they'd known how to do that, they would have done that already. And this is so transformative because it tells them where the problem is.
And it is transformative, isn't it? And I think you've described that really powerfully. So who's actually using this method to date?
So right now, it's been used in Zimbabwe, where it was developed for quite some time. The Union and Center for Health Solutions actually had the opportunity to train all of Kenya in this method, and we were just about in the evaluation phase when COVID came. So we haven't been able to go back and look at the impact, but we hope to. There have been a few trainings in Western Africa online.
And how about going forward? What's in the pipeline?
Well, we're hoping that as the message gets out, many more countries can begin to adopt this method. For me, it's really like the DOTS approach. DOTS was developed by Union consultants. Eventually, people saw what an elegant method it was and adopted by WHO. I have the hope that this is the data form of DOTS, and what we'll see over the next few years is wide adoption in all countries.
Well, thank you so much for joining us here on Union Live. Professor Jane Carter, former president of the Union, thank you so much for coming to the show today. Thank you.
Thank you for bringing data alive.